Hi, my name is Rafi, and I'm here to present WhatGPT. Along with my classmates Sherveen, Jonathan, and Jason, we wanted to figure out whether medical students are aware of ChatGPT or are using it in the context of their clinical work. To start, I want to introduce you to Sassy. This is this dog that went viral when her owner used ChatGPT to find out important information about her condition. Ultimately, the way that her owner Cooper used ChatGPT, he was able to change the way veterinarians treated Sassy and ultimately save her. In general, this vision of increased access to medical information and large language models being used to alter the way medicine is carried out is exactly the vision that developers of GPT and other large language models have. However, the clinical realities of medical information, clinical practice, medical records are vastly different than the idealized ways that we think that medicine might be impacted by language models. We think that medical students will be a great opportunity for us to gain insight into how language models are really being adopted in clinical medicine. Medical students are motivated to adopt new ways to learn and practice. They tend to be tech savvy, and they're the next generation of healthcare providers. We administered a short 3-minute survey, which we distributed in April 2023 to approximately 45 third-year medical students who had completed 10 months of clinical clerkships. First of all, we found that the vast majority of them rely on classic tools such as UpToDate and Amboss for information when they're working in a clinical setting. Also, almost half regularly use Google, and just 2 said that they had ever used ChatGPT. Almost 3/4 of the students had heard of ChatGPT, but less than half had used it. We also found that among those that used it, 4 or 5 said that they had used it to study when preparing for exams or in clinical practice. In closing, as we think about the complex technical, logistic, and ethical challenges ahead, we want to emphasize the importance of tracking the adoption of emerging tools. What we found was that specifically, as of April 2023, medical students prefer their classical tools such as UpToDate, Amboss, and other existing frameworks. More generally, we'd like to emphasize that it is critical to understand where practitioners stand as we develop new tools and try to gain a clear understanding of how they will affect clinical practice. Thank you.